Welcome. Have you ever experienced persistent bladder pain and discomfort, even when your bladder isn't full? Today, we're diving into a chronic bladder condition called interstitial cystitis, or IC. We'll explore what it is, what causes it, how it's diagnosed, and what can be done to manage it. The exact cause of interstitial cystitis remains a bit of a mystery. Researchers believe it's likely a combination of factors that contribute to its development. Some theories point to a defect in the bladder lining, making it more susceptible to irritation from urine. Other potential causes include autoimmune reactions, chronic infections, genetics, allergies, or even nerve damage within the bladder. It's important to note that IC is not a bacterial infection, and antibiotics are therefore ineffective. The pathophysiology of interstitial cystitis is complex and not fully understood. The primary theory revolves around damage to the glycosaminoglycan, or GAG, layer of the bladder lining. This layer acts as a protective barrier, preventing irritating substances in urine from reaching the underlying bladder tissues. When the GAG layer is compromised, urine can leak through, causing inflammation, irritation, and nerve sensitization. This leads to chronic pain and the urge to urinate frequently. Mast cell activation, a type of immune cell, also seems to play a role by releasing inflammatory substances in the bladder wall. Interstitial cystitis can affect people of all ages, genders, and ethnicities, but it's more commonly diagnosed in women. While the exact prevalence is difficult to determine due to underdiagnosis, it's estimated that millions of people worldwide suffer from IC. Diagnosing IC is often challenging, as its symptoms can overlap with other conditions, such as urinary tract infections or overactive bladder. This often leads to delays in receiving an accurate diagnosis. The signs and symptoms of interstitial cystitis can vary significantly from person to person. The most common symptoms include chronic pelvic pain, often described as burning, stabbing, or itching. Many individuals experience a persistent and urgent need to urinate, both during the day and at night, often with small urine volumes. Painful urination or dysuria is another frequent symptom. Some individuals may also experience pain during sexual intercourse. The severity of symptoms can fluctuate over time, with periods of remission followed by flare-ups. Diagnosing interstitial cystitis usually involves a process of elimination to rule out other conditions. Your doctor will likely start with a thorough medical history and physical examination. A urine analysis will be performed to check for infection. A cystoscopy, where a small camera is inserted into the bladder to visualize its lining, may be conducted. During the cystoscopy, a hydrodistension, which involves filling the bladder with fluid, may be performed to stretch the bladder and assess its capacity and any potential abnormalities. A bladder diary, where you track your fluid intake and urination frequency, can also be a helpful tool. Interstitial cystitis is sometimes classified into different subtypes based on cystoscopic findings. Ulcerative IC, characterized by Hunner's lesions or ulcers in the bladder lining, is one type. Non-ulcerative IC is characterized by the absence of these lesions, but with the presence of other IC symptoms. However, these classifications don't dictate treatment and are not used in all circumstances. There's no single cure for interstitial cystitis, so treatment focuses on managing symptoms and improving quality of life. A multimodal approach is often used, involving a combination of therapies. Lifestyle modifications, such as dietary changes to avoid bladder irritants like caffeine, alcohol, and acidic foods, are frequently recommended. Physical therapy can help strengthen pelvic floor muscles and reduce pain. Medications such as pain relievers, antihistamines, and bladder protectants like pentosan polysulfate sodium are commonly prescribed. Bladder instillations, where medication is directly instilled into the bladder, can also be effective. In severe cases, surgical options such as bladder augmentation or urinary diversion may be considered, but these are reserved for individuals who haven't responded to other treatments. While there's no guaranteed way to prevent interstitial cystitis, some strategies may help reduce the risk of flare-ups. These include identifying and avoiding individual trigger foods and beverages, managing stress levels, and maintaining a healthy lifestyle. Pelvic floor exercises, guided by a physical therapist, may also be beneficial. The prognosis for individuals with interstitial cystitis varies greatly. While some experience periods of remission with minimal symptoms, others may have chronic and debilitating pain. Recent research is focused on better understanding the underlying causes of IC and developing more effective treatments. Studies are investigating new medications, including those that target nerve pain and inflammation. Additionally, research into the role of genetics and the microbiome in IC is ongoing, with the hope of identifying potential biomarkers and personalized treatment approaches in the future. With proper management and support, people with IC can often lead fulfilling lives. If you suspect you have IC, It's essential to consult with a healthcare professional for an accurate diagnosis and personalized treatment plan.
Thanks for watching!